Today I am talking about the patient Mr. Hassana Baba, who is a resident of Cameroon. He had a fracture of the elbow for which he had been operated 4 times.
Bonjour, c'est moi, c'est M. Hassana Baba. J'ai fait l'accident le 21 6e mois 2022. J'ai pris la moto pour rentrer à la maison. J'ai fait l'accident. J'ai tombé, mon main droite s'est cassée. J'ai allé plusieurs hôpitaux, peut-être c'est 3 hôpitaux.
He did not have an elbow replacement, but they fixed his elbow. They did ankylosis. That ankylosis did not work, and the patient had his abnormal elbow position.
We hear about the Max Hospital, then we decide to come to the Max Hospital. Then we come here, we see the Dr. Manu, he do the surgery.
When we did the X-ray, we found that there was no bone stock left in the distal humerus. The olecranon and the radius were D-shaped. There was a lot of fibrous tissue over there. It was stiff. It was fixed in a very bad position. We did all the necessary work, and then ultimately we planned elbow replacement surgery.
La toute dernière fois, Dieu m'a aidé pour m'amener à Max Hospital. J'ai réussi l'opération 100%. Mais vraiment remercie, Dr. Manu Padi, je remercie.
And the patient responded very well to the treatment. Next day when I went to the round, he was totally painless. He was very happy. Today, after around 2 weeks from the date of surgery, I have removed the slab and I have made him to bend the elbow. The patient can bend the elbow without any therapy.
Son équipe, je remercie Max Hospital. Il m'a mis travailler, bon travail maintenant. Avant là, j'ai beaucoup de douleurs dans mon main. Maintenant, je n'aime pas les douleurs. Alhamdulillah. Very good. Max Hospital.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.